My name is Janet, and I am a building manager, and I'm a mom to 7-month-old set of twin girls. I just had a feeling that, as like for that particular month, it was going to be positive, because in previous months I'd been testing and I'd been tracking my ovulation. So I just had a feeling that it was going to be that month. And so I went to the office, and like every 10 minutes I would get up, go to the washroom, and then check if there was any blood flow. And there was nothing. So I was just doing that for a while. And then I said, look, I'm just wasting time. Let me just go to the pharmacy, get a test kit, and then come and check. So I went to the pharmacy, got the pregnancy test kit, came back to the office, went to the washroom, and then did the test. And almost immediately, the 2 red lines, I just saw the 2 red lines. And I was like, maybe I didn't do it right. Because I was like, it can't be that simple. So I took the second, and it was the same 2 red lines. And I was very excited. And I had all these fantastic ideas of how I was going to announce my pregnancy to my husband. But everything just flew out the window at that point. I went to the hospital the next day to do the normal blood test, where they check your HCG level to show you're pregnant. I did that, and the results came, and the doctor said yes, I was pregnant. But then they had to do some scans. So they booked me. I went for the scan, and I was chatting with the doctor. And I suddenly realized his facial expressions, it was changing. So I asked him if everything was okay. And he said, yeah. It didn't sound very convincing. So he continued with the scan, and I just kept asking. His expression was getting worse and worse. So I was like, is everything okay? And he said he was going to send the results to my doctor, the doctor who had requested for the scan, and then he would explain things to me. They kept me at the reception for hours, and finally my turn came, and I went in to see the doctor. He also didn't have a very pleasant look on his face. He said they had noticed some abnormalities. My HCG level was abnormally high, seeing that I was just 4 weeks pregnant. It seemed like for someone who was more than 8 weeks pregnant. So he said I should give him a minute, and he was going to consult with another doctor on the way forward. So he left me in the consulting room with a nurse. Fortunately, he left the test results on his table. So I took a peek, and then I would Google. And from all I was seeing, everything seemed very abnormal. So he came in and then said they had to perform a surgery because they suspect it's an ectopic pregnancy, and that they had noticed a cyst going outside of the womb. So looking at the HCG level, it makes sense that it's maybe a twin pregnancy, but the second was growing outside of the womb. I got very scared, and I went to the bathroom, and I shed a few tears, and I was just telling God that's why. I've just known this for 24 hours, and I know He doesn't just give and take like that. So I'm begging Him, whatever He needs to do to resolve this, He should please come to my aid. And then I went back out and then called my husband. Fortunately, he was in a meeting close by, so he came, rushed to the hospital, and the doctor explained things to him, and then they prepared me And I was put in an ambulance to another hospital, a bigger hospital, for the surgery to be done the next day, because if truly it was an ectopic pregnancy, then I was in a very dangerous position. So we got to the hospital, and I was even telling the nurse when we arrived, they were putting me in a wheelchair. And I was telling her that, it's fine, I can just walk. And she was like, no. I do realize the gravity of what is happening to you. Please sit, we'll wheel you. They took me to the room. And for some reason, my husband had left to go back home because I was in the office. And no one had prepared for all of this. So he had to go back home to bring some clothes and toiletries and food. So he left. And a nurse came and said, the specialist who was going to do the surgery had come, and he wants to run some tests himself before the surgery the next morning. This was around 8 p.m. So I was wheeled to the lab and prepared for the scan. But this time he didn't do the external scan. He went in, a device was put inside, and he said, yes, indeed, there are sacs. There's a sac in my womb and outside of the womb. But he doesn't think that other sac is just a cyst. And he doesn't think it's going to develop into a baby. It's just like an abnormal cyst. So an egg that was released. So, with time, it may go on its own. But then he's found another sac inside of the womb, a second one. And he asked if I'd been reading, about pregnancy and all. And I said, yes, I had some knowledge about it. So he said, there's 2 sacs mean like it's a twin pregnancy. And at that point, I was just happy I wasn't going to do any surgery. And it was just a twin pregnancy. And it didn't involve any surgery of any sort. So I was excited about that. And I went back to the room. My husband came and I shared the news with him. And we were both very happy that it turned out to be, 2 babies, and not that, we were completely going to get rid of the one we thought we were having. So God came through for us. My tummy started getting bigger, or it became very noticeable I was pregnant at the beginning of the second trimester, somewhere at the beginning in the middle. So when people would notice, and the few people I told I was pregnant with twins, it was their reaction. The reaction, it was always like such a pleasant reaction. And no matter how I was feeling that day, when I shared the news, the reaction I got, it was just so pleasant. It made me very happy. So I think that was one of the most enjoyable things about being pregnant with twins for me. Yeah. One thing that really stands out for me was at a point I developed an infection. So I had to be admitted. I just went to work one day and I was in a meeting and I started feeling very sharp pains on my side. And I went through the meeting okay, but then just when we finished, I called my husband and told him what was happening, that I couldn't stand the pain and that we had to go to the hospital. So he took me to the hospital and we called my doctor ahead of time. He met us at the hospital and he admitted me and we ran some tests, but he started treating me before while we were waiting for the test results. The test results came and what he was suspecting, the infection he was suspecting, it wasn't that. But after like 2 or 3 days, I felt better. So I took some few more drugs. They observed me for a while, and then I went back home. So that's like one thing that really stands out for me. And also with the back pain and the waist pain and swelling of my feet, and the pregnancy was very heavy. It was quite heavy, so it took a toll on my body. And you know how you always have to sleep, think to your left also. So just like that one position throughout the entire pregnancy it was a lot, and it was just a lot to take in. I couldn't sleep during the day for some reason. I remember seeing some pregnant women in the past, dozing off at work. And I thought that was going to be me because I wasn't getting any sleep at all during the night. But I just couldn't. I just couldn't sleep. I was just up and throughout work, and then I get home, and it was only at night I could get some sleep, and it wasn't much. And you can't move around freely, when you are pregnant. You can't do certain things. When sometimes I forget myself and then just, stand up, forgetting I'm pregnant. And then, like, there's just this force that, brings you back down, like, sit down. So you need to, like, really, slowly get up, slowly, sit down. Actually, I would have to go back a few days prior to delivery. Okay, so when I was 36 weeks pregnant, I went for my weekly checkup, and my doctor asked that I run a scan. I go and then get a scan done, and he went through it and said, looking at how far along I was, and that it being a twin pregnancy, after 36 weeks it becomes more dangerous to go ahead with a pregnancy, waiting to go through normal labor. So he would advise that we have a cesarean section. So I called my husband, and I went alone that day. I called my husband. He came, and then the doctor explained things to the two of us to make a decision as to what we wanted to do, whether we were willing to just wait it out until I go my water breaks and I have to go through normal pregnancy or vaginal birth, or we go with a cesarean section. My husband and I agreed that with all the doctor had explained to us, a cesarean section was our best option. So he asked us to come in the next day, which was a Friday, late afternoon. We went back to the hospital, checked in, got settled, and we're due to have the cesarean section the next day, early in the morning. So I actually knew ahead of time when I was going to meet my girls. So thankfully, I went through the night, and the next day I prepared myself. I took a shower, prayed for a while. My husband came in, we prayed together, and then I went in to the theater. I was prepared for the surgery. So I was given a epidural before the surgery started, and the first shot didn't really work. I don't know why. So when they started the incision, I could feel it. So I alerted the doctor that this is what I was feeling. And he explained that yes, I should feel, the cuts, but it shouldn't be painful. So I told him I could feel the pain. So I was given a second shot, and they started with the surgery. And at a point, I could hear the doctor saying, they should pull. I could feel them literally pulling my tummy apart, And when they brought out the reason why I had to have a cesarean section was also because up until 33 weeks, the first, to make it easier, twin A and twin B. So twin A was head down up until 33 weeks, and then she turned to legs down. And more so because it was a twin pregnancy, there was no way any doctor was going to risk you going through vaginal birth. So up until when we got to the 36th week and she still hadn't flipped, we just knew, C-section was the way forward. So when they brought her out the first time, she wasn't coming out well. So they actually had to push her back in and then reposition her and then bring her out. And then she came out, and then the nurse showed her to me, like, if I could identify, is this a boy, is this a girl? And I said, oh, it's a girl. And they did same with the second. She came out, and they showed her to me, is this a boy, is this a girl? I said, it's a girl, another girl. And they whisked them away. So at that point, my husband left. We had agreed prior to the whole cesarean section that immediately the girls come out, he had to go with the nurse to see to them. He should just leave me. It didn't matter then. At that point, it didn't matter anymore. He should just go with the girls and then make sure, everything is in order. Check their feet and count their toes and their fingers and everything. Make sure everything is fine. That generally they are fine until they are taken to the room. So he left at that point, and they started, sewing me back. Suddenly I felt very alone. There were people in the room, but I felt very alone. And at a point I just thought, am I going to die? I was just so scared. I was just so anxious. I don't know where those feelings came from, but I was suddenly feeling very not myself. And I held on, very tightly to one of the nurses. And, just telling him to tell me everything was going to be okay. And he just kept saying, everything is going to be fine. Everything is going to be fine. And then I held on to him until they finished sewing me up. And I was ready to be taken to the general ward. And one very painful experience for me was when I was being transferred from the surgical bed to the bed I was going to be transferred on. I remember the nurse, insisting that I lift myself up. And to be honest, I couldn't feel anything from, waist down. So I didn't see how I was going to carry myself onto the bed. But they kept insisting that lift yourself up. And then I'm like, I started crying and, saying, how am I going to do this? I can't feel anything. And they just kept shouting at me. And I just broke down. And they eventually carried me onto the bed, face down. Later, my mother-in-law was around, and she was saying she thought, something bad had really happened. Like, they had lost me because they had just covered me with my face down on the bed, and they just rolled me out. So they took me to the general ward for a couple of hours. At a point, I noticed my husband brought the girls and tried to cheer me up. But I was very drowsy, so I couldn't really see anything. But then I noticed they had come there, and he had come with the girls, showed them to me that, oh, look at them, they are fine. I've checked their toes, I've checked their fingers, everything is fine. They're so beautiful. And we were going to be in the room waiting for you to come. I said, okay, and I dozed off to sleep again. So I was just sleeping on and off. And I was really anxious to be moved from there back so that I could go back to my babies. and it took a while. We finished the surgery at about 8 a.m. and I was only allowed back into my room at about 8 p.m. So here I am, first time mother with my babies. And I didn't fully understand what had just happened. I still had my catheter and with an incision, and I wasn't as heavy as before, but my tummy was still out, and I was cleaned up before taken to my room. But then the first night was okay. I just rested and slept throughout. I didn't even realize what was going on around me. But then the next morning, you're encouraged to do things on your own so that just to quicken the pace of your recovery. So I had to go to the bathroom and then clean up myself. And with an incision, you can't take a full bath. So you have your catheter hanging. You have to hang it somewhere and get your stuff together, sit down, clean yourself, try to bath without having a full bath. I don't know how to explain it, but yeah, that was just what happened. And every time with your disposable panties and, you're still bleeding, you still have to bleed. You bleed for a while, for a couple of weeks. And this is what most of us are not told about, You are not told you'd still have your catheter on you. You are not told you are going to be bleeding for this long. You're not told of all the pain. And some people tend to think that sometimes, like CS is the easier way out, but it's not. To be honest, I haven't gone through vaginal birth, so I can't talk about that. But CS is not easy, as some people make it sound. It's difficult, especially after your baby comes and you're still expected to feed your baby and to nurse them and to take care of them. So you're doing all of this, taking care of 2 babies and taking care of yourself. And you tend to, put yourself aside and take care of the babies. Meanwhile, you're equally going through a lot. And at that point, I sort of went through some form of depression. And I'll just be sitting there with my baby, one of the girls in my arms, and just crying. I didn't understand what was going on with me. I didn't know why I was crying. I didn't know why I was sad. But, that's what I was feeling at that time. And I remember being bold enough at one time to share this with someone. And what the person said was that I was being ungrateful and that people, are looking for children. And I didn't get one, I got 2. And I'm here complaining and crying, and that I was ungrateful. But it wasn't that I was ungrateful. I didn't even know what I was going through. I didn't understand it at that point. So it wasn't ingratitude. It was just what I was feeling at that point. And those words even depressed me more. Because I was like, why is all this happening? I mean, I was trying to rationalize what was going on, that yes, it should be like a happy day. But I wasn't happy. And when people even messaged to say congratulations, some I would reply to, and some, I'm like, what's so happy? I mean, there's no happiness here. It took me about 4 to 6 weeks to get over that, gradually. We went back home with the girls and settling in with them, adjusting to our new normal, having to wake up. I had a very horrible neck and headache. And I noticed this prominently when we go home. It was just so horrible, and my blood pressure was still high. So I was on drugs for a while. And even when the girls were crying, it was just so irritable. And it just made my headache worse. And I'm like, why won't these girls just, give me a break? It was a really tough time. Very, very tough time. But things have gotten better. I got better. This whole depression thing, it went, I got better. We got more help at home. And one thing I noticed also was that for most people who would call, a mother gives birth, but then as a child is born, so is a mother. You are not a mother until you give birth. When you have the baby, you've all been birthed, both you and your baby. So it's a new role you're adjusting to. And you have a lot of people, calling, is the baby eating? Is the baby breastfeeding? Is the baby getting enough sleep? Have you done this for the baby? And very few people ask how the mother is doing, And sometimes you just want to be acknowledged that you're going through a lot, and you've been through a lot. And sometimes just how are you doing? It goes a long way. So that was it for me in the first few months or first few weeks after we got home. The headaches and the neck ache, it got better. I stopped having them, and my abdomen used to hurt. My waist used to still hurt. After a while, it got better, and the blood pressure also normalized. And things have gotten better and better since. So there's hope. My breast milk didn't come in till after 3 or 4 days. And going back to twin A and twin B. Twin A she still doesn't want to have anything to do with sucking. She doesn't like to put in any effort to suck anything. It has to flow, into her mouth. But the twin B would suck, so she sucked. So I'll just put her on the breast, and she would suck, although nothing was coming. So it stimulated, the milk glands, I would say, and it's about 3 or 4 days. My milk started coming in, and fortunately they both don't eat at the same time, so I'll feed one, and then, as I said before, the other twin, the first twin, doesn't really like to suck, but if you express, she'll drink from the bottle. So, and it wasn't flowing, the breast milk wasn't flowing a lot. So it also stressed her out, I think she was very stressed, sucking. So she didn't want to have anything to do with it. So from very early on, I noticed that about her. So I don't really stress her too much. It was the second one, the twin B, I put to work to suck and encourage the breast flow, the milk flow. The milk for the 2 babies wasn't enough. Right from the hospital, we started with the formula. So They were doing that. They were feeding on the formula and then some breast milk. It was painful at a point. The sucking, the nipple became sour. I developed like some sore. But I was told that whether sore or no sore, you still have to breastfeed, and it was normal. So I just did that, and sometimes I just couldn't bear the pain. So I would just express and then give it to both of them. I tried everything with ice kinky, soup, drinking lots of water, a burning katie. I did all of that, but Charlie, the milk was just not coming as much as I wish it would. So we resorted to formula, and the breast milk, as and when it came, would feed them with it. I had some few experiences with infections with the first born, also because she wouldn't suck. And with the second, she would always want to come to me because she wanted to suck the breast, feed directly from the breast. So anytime she was being fussy, I just pick her up and then put her there. So I think she got more of the breast milk. So we've had a few challenges with the first one with infections. So breast milk is very, very important. Very, very important. So when the hospital went, all I heard was bum. And then a minute of silence, and then she just screamed. I felt horrible. It's like I'm such a bad mom. My baby fell. Fortunately, we were in the hospital, so the doctor, I had her checked, and they said, oh, baby's fall is normal, unless probably she starts running the temperature or something, but nothing of that sort happened. So I was just complaining the day before that, Aquile has fallen down, and I'm going to do everything in my power to ensure Akoko doesn't fall. And then I leave her with my husband. And just when I saw my husband with me in the kitchen, I was like, this child is going to fall. And all we heard, because we had never seen her roll or move. She's just there. Wherever you place her, she's there until you come back. But then she had also developed, and she just rolled and fell on the floor. We both felt very horrible. But nothing happened afterwards, so. Okay, I don't think they fought in the womb, but there was a lot of kicks. Whenever I wanted, to feel their kick, I'll drink very ice cold water, and that was it. They would be all over the place. And when I felt hungry, and I would go for a scan, they would be like dull and yawning. It was nice seeing them, I saw one of them yawning at a point, and the doctor doing the scan was like, oh, ma, come down, Kolawe. And I was like, no, I'm hungry now, but I'll eat after the scan. It was nice seeing that, but there was a lot of kicks. There were a few times one of the crazy things I did, went to my doctor, and my gynae was very, very patient with me. Very, very patient with me, because I'll just walk into his office and tell him, I've been feeling one kick. The other one is not kicking. What is happening? Like, just go for a scan. At a point, the doctor doing the scan asked me not to come to the place again. He said he didn't want to see me until I was 33 weeks and ready for the babies to come out. I shouldn't come to the place because I was going there too often. Like, every tiny thing, I wanted to know what was going on, to see them, to know they were okay. Are their fingers intact? Is everything okay? Are their heads too big? What's their size? What's their weight? Yeah, that was it. Read a lot. I think reading, when I started reading about the twin pregnancy, what is expected, at every week what you are supposed to see, or the development of the baby. It helped soothe my fears and anxiety. So every time I would go to the doctor, I was more knowledgeable, I was asking more informed questions, and the doctors were, very patient with me. And once they got to know I was reading things for myself, they were more than happy to answer all of my questions. So that really helped. And with twin pregnancy, every woman carries differently. Some may go through it, without any complications. Others would. Whatever it is, it's a phase and it will pass. You'd have your babies in your arms, and, everything. You realize everything, that has happened to you for the number of weeks is for that day that you get to see your baby. So it's all worth it. The pain, the fears, anxiety, the backaches, everything is worth it. And when you have your babies in your arms, it's also beautiful.